Hello, and welcome to SMD 210 Psychosocial Skills. This is a three-part lecture series in which we will be reviewing and learning about basic counseling, referral, and psychosocial skills. Part 1 of this lecture series is to learn and understand and apply basic counseling skills, in particular the basic helping interview and interviewing skills. Let's get started. First, keep a few things in mind before launching into this topic. In every healthcare field, it is important to learn basic counseling skills to provide an intervention and possibly a referral to a mental health provider or other healthcare provider. By learning basic counseling skills, you may feel more comfortable discussing life issues, including mental health issues, with others. However, keep in mind that although you will learn basic counseling skills, this does not qualify you to provide counseling services. Only a licensed mental health provider can provide those services. We are going to learn and review strategies and skills you may use in the future when discussing mental health issues, in whatever role you find yourself in, as an athletic trainer, physical therapist, occupational therapist, nutritionist, strength and conditioning coach, supervisor, parent, or friend. You will, if you have not already, come across someone struggling with a mental health issue. And you may find yourself in a position in which this individual comes to you for help, support, or guidance. Will you know what to do or say? Hopefully, after completing this module and the face-to-face class, you'll feel a bit more comfortable doing so. As a helper, the basic helping interview is a process in which the helper, this is you, listens to the story of the patient or individual and attempts to get a clear picture of the strengths, weaknesses, and issue this person expresses. Remember, you are the quote-unquote helper. This can signify a healthcare provider, a coach, a mentor, a parent, or a supervisor, anyone whom an individual might rely on or go to for help. Let's begin our review of what skills you can learn or improve on in order to make a connection with your patient, athlete, or even friend who may be struggling with a mental health issue and may come to you for help. There are several different attending behaviors that one should be aware of when conducting a quote-unquote interview. Number one, and arguably the most important, is to maintain eye contact. Keep in mind, though, that some backgrounds, such as Latin or Native American descent, can view eye contact or direct eye contact as disrespect. You should verbally track what the person is saying to you and tune in. As you're making eye contact, really listen to and verbally track as well as watch their body language to what they're saying. Be aware of their tone of voice as well as your tone of voice. And be aware of your body posture. Preferably, you would have an open position versus a closed position. An open position is having your arms at your side or in front of you, versus a closed position is crossing your arms and crossing your legs. Ideally, you'd be facing the person and within a safe amount of space between you. Next, we'll talk about questioning skills. Questioning skills support the intentional use of questions designed for specific purposes. Therefore, it is important to select specific ways to ask questions versus just asking them. There are two main types of questions, open and closed questions. Closed questions are going to be used and are useful when seeking specific information, such as yes or no answers or specific questions, like what is your age, where were you born? Open questions will expand the discussion with an individual. Generally, they'll start with what, how, why, or could, and they will result in a broader range of discussion. For example, could you explain how you have been feeling? Each open type of question will give you specific information. What questions will elicit facts and specific details? How questions will elicit processes of a sequence regarding a situation and may also elicit emotions. Why questions elicit reasons and may lead to rationalizations as well as defensiveness. When questions will tell you specific details about time frames. Where questions will tell you specific details about locations, and who questions will tell you specific details about the individuals involved. Now let's review some other specific skills, such as paraphrasing. Paraphrasing is a skill that lets the individual know you have really heard what he, she, or they have said. It is not parroting, but it's a condensed description of what has been said. There are 3 reasons for paraphrasing. Number 1, obviously, to paraphrase the content. Number 2, to facilitate disclosure and communication. And number 3, to demonstrate understanding, that you really do get or understand what the person is telling you. So how do you paraphrase? You're going to recall the person's message to make sure that you have heard it. This is a check for both you and the person you're talking to. You'll identify the content of the message to decide what the person is talking about. Rephrase concisely the key words and the concepts in order to rephrase what has been spoken in new or different words. Include a perception check that allows the person to agree or disagree with you. Let's take a look at an example. If an athlete says, "I have just not been myself lately. I've been feeling overwhelmed and like I have too much on my plate. I usually don't drink alcohol, but I've been trying to be more social, so I've been going to parties and drinking. I'm not sure that's been helping though. I'm feeling really down." You might say, "Okay, so I'm hearing that you don't feel like yourself because you're feeling overwhelmed and sad and have been using alcohol. Is that right?" The athlete spoke in a very detailed manner, whereas the helper, you, paraphrased to highlight the details. I also added in, "Is that right?" at the end as a check to make sure that you and the athlete are on the same page. Another skill includes reflecting feelings. Reflecting feelings is when the helper, becomes aware of the main emotional words the individual or the person you're speaking with may be expressing. Using the specific feeling words used by the individual is a sign of an effective reflection. For example, a patient or someone you know might say to you, "My injury has really changed my outlook about sports. Man, for years soccer was the prime thing in my life since I was 7 years old. Now you're telling me I have to sit out a year to get over this blown out knee. Man, it sucks. It really makes me mad to think I've spent all this time and here I am, a junior on a winning team, and all I could do is sit on the bench. College soccer has been my thing. Man, it hurts and bums me out." You might respond with, "You're hurt and bummed out. Is that right?" That may seem really simple and elementary, but by hearing the words of the emotional feelings that they're telling you and reflecting them back, it tells the individual that you really are not only hearing them, but understanding what they're experiencing. Summarizing is a skill that ideally combines the skills of paraphrasing and reflecting feelings. This is the skill that ideally you would use. So the paraphrasing and reflecting feelings is concise, whereas summarizing incorporates both thoughts and feelings of the individual. This is especially useful when the individual's discussion may get off topic. For example, back to our previous example, you might say, "You've played soccer since you were 7. Here you are in college, injured and feeling hurt and bummed out. Is that right?" So here I combined the paraphrasing of the information as well as reflecting the feelings that the individual stated to me. I also added in a check at the end. In addition to the verbal response that you'll give to an individual who came to you with a mental health issue, you may also reply with something known as encouragers. Encouragers represent short statements a helper can use to keep a conversation going with a patient or another individual. These can be verbal and nonverbal. So verbal encouragers would include, "Go on. Tell me more. Please continue. Uh-huh." And nonverbal encouragers would be a slight nod of the head as the person's talking, or smiling during specific content, or giving different verbal body or nonverbal body language cues. Another skill includes reflection of meaning. Reflection of meaning is designed to help a person explore the meaning of an event or situation that they have been through. The reason why we do reflection of meaning is to better understand what a specific injury, rehab process, event, transition, or issue means to a person. So, for example, we might seek to understand an athlete who has a torn ACL, what they've been concerned with or they're dealing with. Maybe they're dealing with a loss of athletic identity, a loss of belonging to their team, loss of their specific position on the field, maybe a loss of fun or enjoyment, etc. So what does this event mean to the individual person? Because it will be different for everyone. You may have two athletes who have a torn ACL on the same team, and they are experiencing two different outcomes or perceptions on the injury. And one of the most important types of skills that you can gain are confrontation skills. Sometimes these are necessary to help an individual examine the discrepancies they may be experiencing. Often, though, confrontation is seen as a negative interaction. Therefore, we like to reframe this and call it caring confrontation. The idea of caring confrontation is that one is concerned enough about the individual to bring it into the open and talk about this conflict that the person might be experiencing. Confrontation or caring confrontation may need to occur when you find that there may be incongruity between verbal and nonverbal messages, beliefs and experiences, values and behavior, and experiences and plans in an individual. For example, if you ask someone how they're doing and they say, "I'm doing great," but their nonverbal body language says otherwise, maybe something else is going on. Or if they say, "I'm really dedicated to my rehabilitation and I want to get better and get onto the field," but they're not showing up for rehabilitation, they're coming late, they have a negative attitude, etc., this may be something that a caring confrontation may need to occur to find out what else is going on. The four main steps of confrontation includes listening carefully and making sure the relationship between you and this other individual is well established. You're not going to confront someone with an issue if you really don't know them or don't have any type of relationship with them. Present the challenge in a way that the person will most likely accept it. Frame it in a positive light, that you care about them, you're worried about them, you can see these incongruities in their life, and you notice that they may be struggling and that you want to help. Observe the individual's response to the confrontation. Give them a minute to reflect. And follow up the confrontation by rephrasing, as we talked about before. One can also firmly let the individual know how they see the incongruity impacting their work together. For example, the athletic trainer notices that an athlete is off balance, seems out of sorts, is squinting from the facility lights. He says, "Hi, Jim. Are you doing okay? You haven't been in for treatment all week." The athlete says, "Me? Oh yeah, I'm fine. My shoulder's feeling better and I think I'm ready to be cleared to play." "Okay, how is everything else going?" Athlete says, "Totally fine. No problems here. I'm ready to get back on the field." The athletic trainer responds, "Jim, on the one hand, you tell me you want to play, but I'm noticing you're looking a little off. I'm not sure what else is going on, but maybe we can chat somewhere more private and you can fill me in. Would you be okay with that?" This is a great example of caring confrontation, in which you see some incongruity, and although the athlete's telling the athletic trainer that they're feeling better, they're ready to get back on the field, the athletic trainer can tell that something else is wrong. And maybe when they talk in private, the athlete still continues to say that nothing's wrong and they don't feel like sharing. But the athletic trainer can at least provide some sort of confrontation and then let the athlete know, "Well, I'm here for you if you need anything else, and we can always talk later." So wrapping up, each of these interviewing skills can be used to take a step forward in helping an individual. These skills will help you get a better understanding of the individual's perspective and situation, be able to empathize with them, and hopefully help them. The main goal is to dig a little deeper, always go with your gut, and look into red flags if you see them. And don't forget to follow up with the person. This sets you up for the opportunity to possibly refer someone to a mental health provider or other healthcare provider if needed. If there's no interview or confrontation, that opportunity will not be possible. In the next part of our lecture series, we are going to talk about referrals. Move on to the next video.